I've been doing implants for 37 years. So you can imagine I've seen everything, how we come along. I mean, back in the days where we took two-dimensional image, a panoramic x-ray, and off of that, we would measure where the nerve is and then add 25% of that because of the magnification and so on and so forth. So you can imagine we weren't very accurate as to where implants were being placed. We were as accurate as we could be because of the technology that we had. So nowadays, I think the absolute minimum that anybody has to have to do proper implants is a cone beam CBCT x-ray unit. That's a machine that will take a three-dimensional image of the patient's skull, of the jaw, where the implants are going to be placed. Nowadays, there's even more technology that we can use to allow us to get even more accurate. And one is an intraoral scanner. What that is basically a way of taking an image in 3 dimensions of the mouth the way it exists. Let's call it a digital impression of your teeth. If you combine that with the 3-dimensional image of your skull, we now have software where we can create a surgical guide. We can print a guide that can be placed in the mouth, and then all the drilling for the implant placement can be done through this guide. So to me, those 3 pieces of technology are probably the biggest breakthrough that came in the last, say, 15 years, 20 years. They've come down to a point where in the last 6 to 7 years, they're easy to use and readily available to everybody. So for me, those are the 3 main pieces of technology that are important for all dentists to get involved with for accurate implant placement. It's always important to keep up to date, period, with all, especially when we're talking about full arch, because full arch is something that's developed over the years. Technology has brought a lot of advances to us now, where we can do these surgeries in a more comfortable way for the patient, with less invasive, which in essence, or in the end, causes less pain, okay? And then allows us to be more accurate in how we place our implants and the teeth in these full arch cases. So the technology has allowed us to give patients, less time in the chair and less pain with a more precise placement of the implants.